Welcome everybody to April's So What seminar. It's a very sunny day out there, so we really appreciate those of you who've sacrificed your time in the sunshine to come and join us to hear about some research findings. I'm reliably informed by my phone that it's still daylight until 7:39, no, 8:39 tonight, so we can still all catch some sunshine after the event. But hopefully we've got some rays of sunshine to share in our research findings today. Today's So What seminar is all about what we've learned from evaluating 5 school-based interventions, and we'll dig into that in a minute, but I just wanted to start with some housekeeping before we launch into that. So firstly, just to let you know that closed captions are available for this webinar, so you just need to navigate down to the bottom and click on closed captions and you'll be able to see those throughout. The chat is disabled, but we do have the Q&A function. So the Q&A function can be used for 2 things. If you are have questions that come up that you'd like our panel to deal with later on when we get to the discussion part, you'll be able to put your questions in as you go, or you can do that sort of a bit nearer to that time. So please do use it for that. But equally, if you're experiencing anything sort of technical that's going wrong, do just use that Q&A to let the team know that that's an issue, and they'll try and get back to you on those. The webinar is being recorded, so it should be available after the event on YouTube. And also, when it gets to the end of the webinar, you will be sort of directed via a feedback form, which we would really appreciate if you could fill in. So I'll give you another reminder at the end, but just, it really helps us think about whether we're hitting the mark, what we could do better, and what else you might like to see from us. And just to say, I think this is probably not one of our most sensitive seminars in terms of the topics it covers, but we are, of course, talking about mental health, and sometimes we stray onto sensitive topics. So please just do prioritise your own well-being. And if you find anything particularly sensitive or difficult, please do just feel free to take time away from the screen and take a breather if you need to. Great, thank you. Right, I think that's all the housekeeping. So just onto the next slide and we can tell you what we've got for you today. So we've just done the introduction, but I'll introduce colleagues in a minute. And then we're going to have a series of our research colleagues talk through the findings from this programme of research we've been carrying out for a very long time. It's been a labour of love over 7-ish, 8 years, where we've been working with a whole range of schools testing these mental health interventions. So Jan is going to talk through what we call the impact findings, our quantitative findings for the research, and also look at any differences for different subgroups within our population that we tested these interventions with. Emma's going to focus particularly on whether the kind of impact of these interventions differed according to how they were implemented, and Emily's going to talk about the qualitative findings that we had from the research. And I'll just sort of have some summary thoughts on that, and then we'll have our discussion piece where we'll have all of our panel members, including our young person and parent champions, who will be helping us think through what the findings mean and taking your questions, and then I'll just provide some reflections at the end. Okay, next slide. Great. So if I can just ask everybody who's joining us on the panel and speak to pop their cameras on, so they can introduce themselves. I'll start with myself while everyone's doing that. I'm Professor Jess Dayton. I am Director of Applied Research and Evaluation at Anna Freud, and I'm also a Professor of Child Mental Health and Wellbeing at UCL. And stitching those 2 things together, I'm Director of the Evidence-Based Practice Unit, which actually is a kind of applied research unit which sits across UCL and Anna Freud, and I led on this particular programme of research. So I'll just call people out as I see them. So Jan, would you like to introduce yourself next?
Yeah, hi, thank you for having me. Good evening. My name is Jan Böhnke. I'm a reader at the University of Dundee, a psychologist by training, and I am the methodologist and trials lead for this study, and that's what I do as a large part of my work here at the School of Health Sciences in Scotland.
Lovely. Thanks so much, Jan. Emma, would you like to just pop your camera on and introduce yourself?
Hi everyone, I'm Emma Thornton. I'm based at the University of Manchester, and I am a research associate, so I was working on education for wellbeing sort of as the data manager. Yeah, it's nice to meet you all.
Thanks, Emma. Emily, would you like to introduce yourself?
Hi everyone, my name is Emily Stapley and I'm a Senior Research Fellow in Applied Research and Evaluation at Anna Freud, and I was Qualitative Research Lead for Education for Wellbeing.
Thanks, Emily. And Gigi, would you like to introduce yourself? Oh, you're on mute.
Hi, I'm Gigi and I'm a young champion at Anna Freud.
I'm brilliant to have you with us, Gigi. I can't speak. Yeah, and we'll come back to chatting with you in the panel later. Looking forward to it. And Kate, would you like to introduce yourself?
Hello, I'm Kate and I'm the parent champion for Anna Freud. Not the parent champion, but a parent champion for Anna Freud. Apologies about the bright sunlight in the background. I also happen to be a teacher as well as a mum, so I've kind of got two hats on tonight.
Thanks, Kate. Yeah, we're looking forward to hearing your reflections later too. Thanks for joining us. And Martha, would you like to introduce yourself?
Hi, I'm Martha. I'm the Programme Coordinator for Applied Research and Evaluation here at Anna Freud, and you'll be hearing more from me later for the Q&A.
Thanks, Martha. That's great. Lovely. Okay, so we'll just move on then to the next slide. So I did mention before that I'm Director of the Evidence-Based Practice Unit, so I was just going to say a little bit more about what EBPU is. And I was just thinking to myself, EBPU is going to be 20 years old next year, so we're going to have to mark that. It's a long-standing collaboration between Anna Freud and UCL Faculty of Brain Sciences. And the idea is that we try to bridge the worlds of research and innovative practice in terms of children's mental health and well-being. We work very closely with our colleagues in the Child Outcomes Research Consortium, who are based with me at Anna Freud. And they are a leading sort of membership organisation that collects and uses evidence to improve children and young people's mental health and well-being, very much in a kind of using evidence to improve services and practice on the ground, essentially. And EBPU very much is in the business of very applied research. So essentially what that means is all of our research activity, we apply the so what principle, which is if we can't have a conversation with someone who's either a young person themselves or working directly with young people trying to support their mental health, and we can't answer the question, so what, in response to sharing our research findings, then we probably shouldn't be doing it. And that's really where these research seminars come from, is trying to bring out those sort of so what aspects of our research so that we can have a think about what their implications are for what should be happening on the ground, I suppose. Great. Okay, so let's move on to talk a bit more about education for wellbeing then. So just to give you a sense of what this programme was, as I said, it's been a very long-term project. We started in earnest in 2017 on this project. We had some time to sort of feasibility test and kind of pilot some of the approaches, but it was commissioned by the Department for Education, and they had a number of questions that they were trying to tackle about what these kind of universal preventative mental health programs in schools ought to look like. And so they commissioned this research with sort of two kind of problems to try and bottom out a bit more. So one is around the fact that there are evidence-based programs out there in the world that have been tried and tested in other countries and found to be effective, but we have limited evidence about whether they work in English schools. So one of the questions was, can we take some of the best, what looked like the most promising interventions from elsewhere and try them in English schools and see if they show promise in the same way? And that trial particularly is called AWARE. It was only for secondary schools, and I'll say a bit more about the interventions in that programme in a minute. Inspire was much more about trying to distill what might be seen as common practices within schools. So schools will quite often sort of implement their own kind of ways of introducing sort of light touch well-being, mental health kind of exercises within the school day. And DFE, we're trying to collect information about the most common of these approaches, and saying that, well, okay, if we can sort of systematize these a bit and understand a bit about whether they are sort of worth schools spending their time on, then that would be helpful to communicate to schools whether these things sort of do show kind of evidence of promise. So that's what the Inspire trial was all about, and that was carried out in both primary and secondary schools. So if we move on, I can say a bit more about the AWARE trial. So AWARE, as I said, was the one that was testing interventions that had been established elsewhere. The first of those was known as YAM, which stands for Youth Aware of Mental Health. It very much focuses on mental health awareness. It's a 5-session programme, and it was the only one of our interventions that aimed to bring professionals from outside the school, essentially, who would be working directly with young people, but actually not with teachers or any school staff in the room at the time. So these were quite sort of discursive, dynamic sessions where there would be lots of discussion and role play around mental health topics, and a lot of sort of discussion of common mental disorders, and also quite sensitive issues like self-harm and suicide. And the way it's been tried elsewhere is as a suicide prevention programme. But in this trial, we were looking at its ability to reduce emotional difficulty, so depressive symptoms, essentially. And then the guide was the second intervention. This was a mental health literacy programme. And this was instead actually training teachers to deliver this 6-session programme within school, sort of in lesson time, essentially. And again, it covered the same, some similarities in topics. It was about tackling stigma, common mental health problems, improving knowledge around mental health and common mental disorders, and talking about sort of support networks as well. So that's the AWARE trial. So moving on, we can talk about the INSPIRE trial in a bit more detail. So the types of approaches that DFE identified that they felt were sort of most common and probably had most sort of potential for being evaluated in schools were mindfulness-based exercises. So this was not the very intensive mindfulness kind of programs that can be common in schools, but something much more light touch. So mindfulness exercises, sort of 5 minutes a day, just drip fed each day across the week over an extended period of time, and to see whether that had a benefit for emotional difficulties. And then quite a similar approach, but a little bit different, was relaxation techniques. So again, very similar. Could we put something light touch in place? Quite commonly, schools would do things like sort of breathing exercises or muscle relaxation. So could we see if sort of 5 minutes a day of those kind of exercises might be beneficial for emotional difficulties? And then the final intervention was something that kind of emerged as we were developing the beginnings of the programme. It first came from thinking about a approach known as protective behaviours, which was much more around safeguarding and young people knowing when they're safe or when they might not be safe, and how to think about that in a sort of systematic way that sort of brought it to the fore in their minds. But it wasn't really very mental health focused. So our colleagues in the schools division spent a lot of time developing, sort of co-producing really with school staff and young people, this approach with a greater focus on well-being and mental health, which was very much around how young people could look after their mental health, knowing what was the kind of pitch and thrust of everyday emotion, and where that might reach a tipping point where it was something perhaps they couldn't manage on their own and they might need additional support, and also thinking about where those support networks were. So again, each of these were a training was provided to teachers, and then teachers delivered it in the class. So that's the full set of trials and all 5 interventions. So just moving on from there, I'll just say a bit about the design of the kind of trial itself. So actually the programme involves 3 separate trials. So AWARE is the one that tests the 2 tried and tested interventions, and it's a cluster randomised trial. And what that means is essentially just that each school involved in the trial is randomly allocated to either YAM as an intervention, the guide, or what we would call a usual practice, which just means the school continues with what it would usually do. As long as it's not YAM or the guide, they can carry on giving the same kind of provision that they would have done before the trial started. And what we then do is compare each of the intervention groups to the usual practice group to see if they show greater improvement in mental health outcomes relative to the usual practice group. So that's AWARE. So INSPIRE was very similar. So just moving on to the next slide for that. You can see the same kind of approach. So essentially schools in this trial were either allocated to relaxation and mindfulness, strategies for safety and wellbeing, or usual practice. And again, we're not comparing them to each other, we're just comparing each intervention to the usual practice group. And so it looks exactly the same, essentially, in primary schools and secondary schools. So that's the structure. And then just thinking about how this sort of looked in an academic year, if we move on to the next slide, you'll be able to see how that works. So essentially, in order for us to look at that change over time for those different groups, what we did at the outset was we took what we call baseline measures. So at the beginning, before the intervention started, measures of emotional difficulties, mental health literacy, subjective well-being, and many more things besides. And it was only after we collected that information that we randomly allocated the schools to these different conditions. After that random allocation had happened, for where training was relevant in the schools, teachers were trained sort of in the period before Christmas, essentially. And then when it came to after Christmas, so that period between Christmas and Easter holidays in schools, all the interventions were rolling, so they were all being rolled out within the schools. And then immediately after that, so after they come back from the spring break, we'd have the first follow-up of measures looking again at those outcomes that we're interested in. So emotional difficulties, mental health literacy, and sort of subjective well-being. And then we also looked at those same outcomes a whole year after the intervention was initially trialled. So that was the process. It happened in several waves. One of them was pre-COVID, one of them was during COVID, which obviously interrupted things significantly. So we had a post-COVID wave as well, but they all followed this kind of format. Okay, moving on, I'll say a little bit about how the analysis broke down. So essentially, because it's very big and complex trial, it actually broke down into a load of different layers. And I've got a quantitative analysis here, but it was actually qualitative as well, as you'll see on the slide. So initially, there was the impact analysis. So that's when we're saying, essentially, the question we're answering here is, did it work? Can we see an effect on what we call the primary outcome? So for some of these interventions, so for YAM and relaxation and mindfulness, our primary outcome was emotional difficulties. So could we see change in that? And then for strategies and safety and well-being and the guide, we were interested in whether it improved sort of help seeking and likelihood to seek help if you had problems in future. So that's very much what the impact findings are looking at in the short and long term. We also looked at something that Emma's going to talk through shortly, which is what we call complier average causal effect. But essentially, you don't need to worry too much about that language, but what that's doing is looking at whether how well the implementation happens affects the kind of benefits on the outcome. So if it's delivered in full versus only delivered, a few sessions, for example, does that make a difference to the kind of benefits or the kind of strength of the effect, essentially? Then we also carried out what we call modification analyses. So that just means, does this work differently for different subgroups of young people? So we had a range of different subgroups that we could explore, including whether children were eligible for free school meals or not, the sex of the young people, their ethnicity, whether they have special educational needs or not, and even, what the level of similar existing sort of pre-existing mental health provision within each of the schools. We also had some analysis we're not going to talk about today, but that were to do with the cost effectiveness of the interventions. And also we had qualitative case studies, interviews with staff and young people that Emily's going to talk through a bit later on. So that's just me kind of setting the scene, really. We'll move on now to Jan, who's going to talk us through those impact and modification findings. So Jan, over to you.
Yeah, thank you for that. And what I tried to do with the following presentation is not to produce death by PowerPoint or tables or so, but to tell one narrative of how we get from the raw results to the evidence briefings that you find in different places with different institutions. So if we can move on to the next slide. So I'll give one example about how we derive these recommendations around the impact results, what that looks like, and what types of evidence or what types of results we're pulling there together. And then an example for the effect modification and what those are, I'll talk through in a minute. Next slide. Okay, and as Jess already has alluded to, the resources are in several places, so the probably deepest dive into any of the things that we're presenting today is in the papers that you find on the Open Science Framework, OSF. The Department for Education has produced some really good evidence briefings with us together, and then there's also a good summary of these that I'll rely on in the presentation later on, that you just found in the chat that has been shared by Magdalena, I think, where there's a brief summary of all the intervention results. And also acknowledging with this slide just really the massive number of institutions who have contributed to this, as well as the high number of individuals. We probably should put a slide up at the end, just in the individual count who have worked on this. But yeah, thank you. So it's a really big team effort, such a program. If we can go to the next slide. I promised you not to do really focus on these tables, but this is basically where we start from. Yeah, so this is looking at where. This is looking at this first time point, 3 to 6 months after the intervention was implemented, and what we have are results in the first top half of the table. So about the primary outcome for YAM. So the thing that we thought after consultation, YAM was most likely to change, the short moods and feelings questionnaire in this case, and then for the guide, which has a different outcome, the general help-seeking questionnaire. And below that, there's a number of so-called secondary outcomes, so all kinds of additional things that either from the literature, from consultation, or for other reasons we thought might be potentially impacted by the intervention, but who wouldn't be decisive in us evaluating whether the intervention was achieving the goals that we set out originally to do. Next slide. And that is then translated into these statements that you find in the evidence briefings, that the guide had a statistically significant effect. In the short term, the guide did something. There's something about a however, and then there's implementation findings. And I'll talk you briefly through how we get to these individual statements from those tables. So if we go back to the table, the next slide, we have the first sentence of that briefing basically stating there in the green field. So there's something called an effect size that quantifies whether the intervention had an effect in the anticipated direction and of an anticipated size. So when we set out with this program, we thought 0.2 or higher would be really good. This is a bit smaller than that. And we have something called a confidence interval, so how wide we think this effect might be varying, which excludes 0 in this case, which indicates that at least from this given trial, we wouldn't necessarily conclude that the result is 0, that there was no difference between these groups, but rather that we found potentially a difference between the group of schools who received the guide intervention and those who received the control intervention. Next slide. And we swap this over. Another bit of results that feeds into these statements are those green fields at the bottom. So we have different measures of knowledge, behaviors, and attitudes around stigma. And they all fulfill this criterion that they have a effect size measure that whose confidence interval is not overlapping with 0, so it has potentially an effect. If we go to the next slide, then we see that we have those first 2 points covered with those. The guide had a statistically significant impact on young people's intended help seeking at the short-term follow-up. It was the primary outcome, what we planned to change with this intervention, and it was at the 3 to 6 months after the intervention delivery. Then in the short term, the guide was also associated with improvements on some of the measures, and that is referring to those secondary outcomes, those things that we thought, they might be theoretically related to this, but that wouldn't be the main goal why this intervention would be implemented in the schools. And what we didn't see on the previous table, but basically we could, and we have done tables for each of these different time points and for all trials and so on. But there's an equivalent table for the 9 to 12 months outcomes. And what we saw there is that it was the guide compared to usual provision was also associated with increased emotional difficulties and decreased life satisfaction in the long term. And that is important because this might be a potential negative effect. And that's leading to the recommendation that we'll see in a minute. And the point in red is the thing that Emma will talk about in more detail, that the implementation findings suggest that receiving all sessions of the guide compared to not all of them is actually amplifying the benefits of the intervention. But yeah, you will hear more about that in a few minutes. We can go to the next slide. That leads then to this whole package of statements around what we think we show with the quantitative results, at least. Bold phase, the evidence from this study does not recommend the guide as an intervention for young people in secondary schools for the reasons that, while we find an effect, it's in the right direction, but it's smaller than was originally intended. That leads potentially to it not being cost effective, which we're not discussing today, unfortunately, but that is part of that, and especially since the potential effect for long-term negative effects. And the latter leads then also to, at the bottom of the statement, to the recommendation, well, if you implement it, we're not recommending against doing it. There's no strong evidence against this intervention. Then you need probably to monitor the impact on participating young people and ensure adequate support in the long term. Okay, so that's the guide, and that's how we come from the quantitative findings in different parts of analyses to these statements. We can go to the next slide. We see this other intervention from this trial, YAM, and here basically we have the same structure, and the finding here is evidence from this study does not recommend YAM either. And in this case, we also have no overall impact, and there's potentially also small but longer term increases in emotional difficulties potentially. And that's piecing those bits of results together. With the next slide, we then come to the INSPIRE trial. And here we always have to remember we did the same thing, but we did it for primary schools and we did it for secondary schools. And that's why the recommendations are in some cases split. So for example, for strategies for safety and well-being, we have it as a recommended intervention for primary schools, but it may require refresher sessions because in the long term, it wasn't clear whether there was still a signal or of the same size as originally or after the shorter term intervention. And in secondary schools, it is showing promise, but only if it is implemented in full. And again, you'll hear more about this from Emma in a few minutes. Moving on to the next intervention, relaxation techniques. And relaxation techniques shows promise as an intervention in primary schools if it is implemented consistently and regularly. Again, it's the implementation finding. And we do not recommend it for secondary schools because there were no overall effects, and it potentially negatively affected emotional difficulties in the long run as well. And the final intervention of this trial, if we can go to the next slide, mindfulness has a bit of a longer section, but is essentially also the same. So mindfulness exercises shows a promise as an intervention for secondary schools if it's implemented consistently and regularly. But it's not recommended in turn for the primary schools due to potential adverse effects with some groups of pupils at high levels of implementation. And that is basically, well, you can go backwards through tables and all of these results for each of these. That would require a bit more time than we have, and also due to the audience, maybe as the different briefings that are provided, where you can self-select of whether you want to read the papers, the DFE detail, or the Anna Freud briefings. You can see what is the most useful resource for you. It's a bit easier than presenting that for everyone in one particular way. But we can discuss many of these later on in the panel. If we can move on to the next slide, we'll talk a bit about the last thing called effect modification, which is a fancy word for saying that the intervention itself, for example, the guide or YAM, does not necessarily have the same effect for all groups. And with groups, we mean that it might be, for example, it might work better for certain pupils or students in those schools. So it is associated with demographics, or it might be due to the school context in which they are delivered, that the intervention works better or worse. And you might find the word differential intervention effects for that, which means essentially the same thing. So intervention is delivered, but not the same result is achieved for every school or for every pupil based on demographic variables or so. Moderators of the intervention effect is also what we say. So what did we look at? And you had this briefly already in Jess's slides. We had sex, free school meals, ethnicity. Well, one of the limitations of such a trial certainly that we didn't have a very detailed breakdown of those, for example, equally for sex and gender and so on. I think we already acknowledged in other discussions that we might set this study up differently today than in 2017. And for example, then also sense status. And for schools, we had those variables that we used to stratify the trial, and those were whether it's a rural or urban situated school, previous implementation of such programs, and the school level of deprivation. And if we go to the next slide, and again, we could have loads and loads of tables, and I'm just going to highlight some of the things here. So since we talked about the guide, or I talked about the guide so far, I'm just focusing here briefly on the guide. For the 3 to 6 months follow-up point, there was nothing that we found, which means mainly that with our fairly large sample size, and there were no effects that were large enough to be detected. So it's probably very, very small, if anything at all. And at the 9 to 12 months follow-up, we found, for example, that girls showed higher levels of help seeking compared to boys in the intervention group, but there was no gender difference in the control group. So there might have been a slight differential effect of the guide in the longer run. And if we go to the next slide, I talked briefly about mindfulness. We're here in the INSPIRE trial again for primary schools. And we see, for example, at the 3 to 6 months, mindfulness improved emotional difficulties more for girls than boys. Schools with prior intervention have higher depressive symptoms on average compared to schools without such things at the short term. And in the longer term, there were differential effects by special educational needs and mental health difficulties at baseline, for example, they did worse in the long run. And pupils in urban schools had lower emotional difficulties after the intervention at this time point. And we could discuss these in detail. So if we can go maybe 2 slides forward, because I'm not going to talk about the secondary schools in detail, because, well, the differential effects and effect modifications overall are very, very small. And we find no consistent results across outcomes in our time. That doesn't mean that there's none and there's nothing that we shouldn't investigate further, but there is, from the impact perspective, very little that led to believe that there were strong indications that it was particularly useful to target the intervention for some particular setting, like urban versus rural schools or something like that, or particular demographics. But on the other hand, there was also not much of an indication that it was potentially worse or detrimental to particular groups on a larger scale. And in that sense, these are sensitivity analyses for the trial results, where we're in the first place only interested in whether the intervention on average might have an effect at all or not. We're going to get a bit more differentiated than that with Emma's presentation in a minute or two. What we also did is we explored missingness and dropout, and for the primary outcomes across all interventions, and we found the same results across all, so there was no change. And the impact of implementation as a sensitivity analysis is something that Emma will pick up now. And with that, I'll hand over to Emma.
Thanks so much, Jan. Yeah, we will take questions at the end. So yeah, over to you, Emma, for the next bit.
Hello. Okay, so the title of this is a bit of a mouthful, but essentially it is going to look at the effect of implementation on the effectiveness of these interventions. So just a quick acknowledgement to my colleagues, Chris Knowles and Neil Humphrey as well, who I did the work within this presentation with them. So just a quick acknowledgement. Next slide, please. So just as a bit of background then, intent to treat analyses, which are sort of those analyses that Jan spoke about, analyzes everybody as if they were, analyzes everybody as they were allocated. So by that, we mean participants are analysed based on the condition that they're allocated to, and this doesn't account for people who are allocated to the intervention but might not receive it, and it assumes that participants are behaving as expected. So schools that are in the intervention condition deliver all of the intervention how it's supposed to be delivered. We know in practice this isn't always the case. So there's a myriad of reasons. We know that schools are really busy places, so there'll be time constraints, competing demands, competing priorities, and also how the intervention is sort of evaluated by the people delivering it. If teachers or whoever's delivering the intervention think it's probably not very good, they're less likely to deliver it. So there's quite a few reasons why this isn't always the case. Implementation dosage basically refers to how much of the intervention is received, and it's thought to be a key modifier of those treatment effects that Jan was discussing in his presentation. And by a modifier here, we basically mean something that's going to affect the relationship between the intervention and the outcome. Next slide, please. So complier average causal effect analysis, or CASE for short, offers a useful complement to those intent to treat analyses. The intent to treat analyses may underestimate treatment effects, particularly if there is considerable variation in implementation, so in how much of the intervention is delivered. So CASE is an analytical method that accounts for variability in dosage, and I'll try and give a very non-technical overview of quite a technical method, but it essentially uses probabilities to group pupils in both intervention conditions and intervention schools and usual practice schools as either compliers or non-compliers. So for pupils in intervention schools, we will have their compliance information, but for pupils in usual practice schools, compliance information is by definition missing because they didn't receive the intervention. But what CASE does is it uses responses on plausible predictors of compliance, which I'll talk about in a few slides, to sort of try and probabilistically group people in the control group as compliers or non-compliers. And it then uses statistical techniques to compare outcomes between compliers. So by compliers, I mean people who received the intervention as they should have received it. So the resulting CASE effect compares compliance in intervention schools to compliance in control schools, and the resulting CASE estimate tells us the effects of the intervention among compliers. So all that you need to really know about that is that the CASE estimate tells us the effects of the intervention among those who complied, and I'll define compliance in a couple of slides. So if we just go to the next slide, please. So as a very high level overview, the CASE process is as follows. You'd first determine a compliance metric. So for example, the number of sessions delivered, and then also a threshold. So for example, we might say people who received at least 7 out of 10 sessions were what we would call compliers. You'd then identify compliers and non-compliers in the intervention group. So all you would do here is look at the statistics of who was above that threshold and who was below that threshold. And then you'd use available data on predictors of compliance to estimate who would have been compliers and who would have been non-compliers in the control group had they been randomised to receive the intervention. And then you'd compare the outcomes for compliers in the intervention group and would-be compliers in the control group. So would-be compliers are those who would have complied to the intervention had they been randomised to receive it. Next slide, please. So we had different compliance metrics. We used dosage because we wanted to just know how much of the intervention was delivered, whether or not that affected results essentially. but case needs a binary indication of compliance. So it basically needs two categories of they complied or they didn't comply. And our sort of interventions didn't neatly fall into that. We collected compliance data at the teacher level, so the teachers who were involved in delivering the intervention completed what we called an implementation survey, and then we disaggregated that to the pupil level by matching on class ID. So every pupil had a compliance metric, a compliance outcome, so they were either complier or non-complier based on the classroom membership. And compliance for control schools is labelled as missing to start with and then is probabilistically estimated. So the rest of this presentation is just going to be organised into the curriculum-based interventions and the minutes-based interventions, because we had different compliance metrics due to how dosage was measured. So for the curriculum-based interventions, dosage was measured in terms of the number of sessions delivered. But for the minutes-based interventions, so the mindfulness and relaxation interventions, it was essentially a continuous measure of how many minutes pupils received. So the rest of the presentation will be organised into these two groups rather than aware and inspire. Next slide, please. So for the curriculum-based interventions, compliance was defined as completeness of delivery. So schools that received all sessions of a given intervention were classed as compliers, and schools that received less than all sessions were non-compliers. So we had 4 case models for curriculum-based interventions. We had one for YAM. So YAM consisted of 5 sessions, and actually when we looked at the data, everybody who received YAM either received all 5 sessions or they didn't deliver it at all. So that was how we split compliers and non-compliers for YAM. For the guide, compliers were those who received all 6 sessions, non-compliers were those who received less than 6. And then we had 2 models for SSW, Strategies for Safety and Wellbeing. We had one in primary school and one in secondary school. And in both cases, those who received all 8 sessions were compliers, and those who received less than 8 were non-compliers. Next slide, please. For the minutes-based interventions, it was a little bit less clear-cut. So, as I mentioned, dosage was captured in terms of the minutes of intervention received, but there's no clear theoretical or empirical threshold for what might constitute compliance in these cases. So we instead looked at the cumulative amount of an intervention received in the specified period, and we split that into 2 different thresholds. So we had the 50th percentile, which we called moderate compliers, and the 75th percentile, which we called high compliers. And this resulted in 8 models. So we had 4 mindfulness and 4 relaxation, which I've broken down, I think, on the next slide. So if we go to the next slide, please. Yeah. So for mindfulness, we had the 2 models for primary school, moderate compliers and high compliers. And this is the compliance threshold for each of those in primary schools and then again in secondary schools. So for example, moderate compliers in primary schools for mindfulness, those who received either 325 minutes or more over the intervention period were moderate compliers. Those that received less were non-compliers. And then it was a separate model for high compliers. Next slide, please. This just demonstrates the same thing again with the threshold cutoffs for relaxation in primary schools and secondary schools, so I won't go through those, they're just on the slide. Next slide, please. So we had 2 outcomes, 1 primary outcomes depending on which intervention we were looking at. So for the guide and strategies for safety and wellbeing, it was help-seeking behaviour. So a higher score indicates more help-seeking behaviour, which is good. For YAM, mindfulness and relaxation, it was emotional symptoms. So a higher score indicates more emotional symptoms, which is bad. Next slide, please. So I mentioned earlier those predictors of compliance. So across our models, we had some pupil level and school level predictors of compliance, and they were used to predict which pupils in control schools would be compliers. So at the pupil level, we had baseline emotional difficulties, and in the case of the guide and SSW, baseline help seeking. We also had baseline behavioural difficulties and gender. And then at the school level, we had a series of variables to see whether or not the school was already implementing mental health provisions. So we thought that if they were already doing something, maybe they'd be less likely to comply to something else. The level of staff mental health training provision within the school, the trial wave, and as sort of an indication of the socioeconomic circumstances of the school, we used the most deprived free school meal tertile as well. Next slide, please. So overall, we had 12 case models, which are just broken down there. Hopefully that's clear to see how they were split up. So we basically did this each time, once for each entry on the table, resulting in 12 models. Next slide, please. So this table summarises the results for the curriculum-based interventions. So we've got the intervention, the compliance threshold for that intervention, the number of compliers across the intervention and control school as estimated by the case model. And then probably most importantly, we've got the intent to treat findings, so the main impact findings and the case findings. So for YAM, there was no effect in the impact findings, but once we took implementation into account, we found that YAM reduced emotional difficulties. For the guide, there was an effect at intent to treat level, but we found that when pupils received all 6 sessions compared to less than 6 sessions, that impact on help seeking increased further, so it amplified that effect. The case effect for strategies for safety and wellbeing in primary schools was exactly the same as it was at intent to treat, so the effect was not amplified when all 8 sessions were delivered. And for SSW in secondary schools, there was no effect at the intent to treat level, but when we took dosage into account, we found that strategies for safety and wellbeing increased help-seeking behaviour. Next slide, please. Here we've got the results for mindfulness in primary schools and secondary schools. So it might immediately jump out at you here that some of these cells are highlighted in red. So for mindfulness in primary schools, there was no effect at the intent to treat level, but we actually found that when compliance was taken into account, mindfulness increased emotional difficulties, so pupils were reporting poorer mental health at the first follow-up, so 3 to 6 months later. And this was the case at both moderate compliance, and then there were further increases at high compliance. So that was in primary schools, and we essentially found the opposite in secondary schools. So again, there was no effect at intent to treat, but then when we took compliance into account, we found the effect that we expected to see, where emotional difficulties were reduced, and they were further reduced at levels of high compliance. Next slide, please. Thank you. So these are the results for relaxation practice-based interventions. So again, there's some red on the screen. This time for relaxation in secondary schools, we found that compliance was increasing emotional difficulties, but in primary schools, it was reducing emotional difficulties. So it's kind of the flip of what we observed for mindfulness. However, you'd see that for the high compliance threshold for primary schools, it's sort of in a paler green. That's just because there was no additional benefit on top of moderate compliance. Next slide, please. So I've just thrown quite a complicated analysis at you and quite a lot of findings. So what does it all mean? The first and foremost, implementation is important. We're seeing different findings across the board, with the exception of strategies for safety and wellbeing in primary school, where the case findings are different to the intent to treat findings, whether that be there was no effect at intent to treat, but there is an effect when we look at compliance, or whether it's an increased effect, or indeed with the case of mindfulness in primary schools and relaxation in secondary schools, we've got those negative effects. So when we take compliance into account, there are clear intervention effects, regardless of the fact that at ITT there weren't that many. So this kind of supports the idea that intent to treat analyses might mask potential treatment effects. They might underestimate those effects. And as we saw, for example, with the guide, increased delivery might amplify some effects that we'd seen. And similarly with mindfulness and relaxation, where we didn't see those negative effects, the additional delivery at high compliance, in most cases, further increased the intervention effect. However, we did have some evidence of iatrogenic effects, so the effects that we didn't expect to see, where we actually saw the unintended increases in outcomes. So some interventions might not be appropriate in all educational contexts, but overall, regardless of those contexts where they might not sort of be appropriate, the fact that implementation is important suggests that strategies that facilitate and support complete delivery might be beneficial for delivery. And we kind of go into this in the papers. So if you go on to the next slide, please. There's just a couple of links to the preprints. So those papers where we've written up this case analysis are split into the structure that I took through this presentation. So we've got the sort of curriculum interventions in one paper and then mindfulness and relaxation in another paper. Thank you.
Brilliant. Thanks so much, Emma. I really like those tables summarising results as well. We talked a lot about quantitative findings, but I can see there were some questions in the chat about, how is this received by teachers and that sort of thing. So, that seems very timely that we should be handing over to Emily to talk about the qualitative findings. Thanks, Emily.
Yes, I saw that and I was like, oh, this is good, this is coming. Okay, so if we could go on to next slide, please. So we invited staff across all Wave 1 schools in 2018 to express interest in being a case study school. We then selected 20 case study schools with variation in contextual factors, so such as rural versus urban location. And this included 11 secondary schools, 8 primary schools and 1 middle school. And the majority of the schools in our qualitative case study sample were co-educational, apart from 2 single set schools, and almost all of the schools were state funded. Next slide, please. So in terms of young people's experiences of mindfulness-based exercises and relaxation techniques, next slide. So we conducted 14 focus groups with 65 young people aged 8 to 12 across 7 schools, the majority of which were primary schools. Next slide, please. And in terms of the barriers and facilitators to delivery and impact of those 2 interventions from young people's perspectives, so we found that having a quiet, distraction-free environment and a space where young people could sit, stand or move comfortably was important from young people's perspectives. We also found that there was a preference for having the interventions after lunch or break time, as this provided an opportunity for young people to calm down and focus before lessons. More variety in activities was requested, though, by young people to prevent boredom. Next slide, please. In terms of impact, so many young people who we spoke to reported benefits of the interventions for their mental health and well-being, so such as feeling happier and managing anger and stress better. We also identified a difference in the mechanisms behind these outcomes from young people's perspectives. So relaxation techniques were noted for taking difficult feelings away, whilst mindfulness-based exercises were seen as distracting young people from or helping them to forget problems and let difficult feelings go. But some young people also experienced annoyance, stress, or physical discomfort from the activities. And young people were divided in terms of whether they would use the mindfulness and relaxation techniques that they learned outside of the sessions. Some described how they were already using the techniques in situations outside of the sessions when they might be feeling angry, upset, stressed, or worried. So such as when playing sport or in relation to difficulties with family, friends, or schoolwork. But other young people who we spoke to didn't see the techniques as something that would be useful for them, such as because they were seen as potentially being more relevant for others who might need them more than me. Next slide, please. Young people also reported a positive impact of the interventions on classroom dynamics from their perspective. So specifically, they noted that the classroom felt calmer and quieter after the sessions, which had helped them to feel more ready for and focused on their lessons. They also felt that the interventions had helped them to better manage arguments with peers, and so commented on peer relationships in the classroom as a result of the interventions. Next slide, please. But what did the young people think about the other 3 interventions? So the guide, YAM, and SSW. Next slide, please. So to explore this, we conducted focus groups with 95 young people aged 8 to 14 across 12 schools. And this time, the majority of these schools were secondary schools. Next slide, please. So the young people who we spoke to reported gaining new knowledge from the interventions about mental disorders and symptoms, and learning ways to handle mental health difficulties or unsafe situations. And this included who to ask for help from if they needed it. They often reference their ability to help others, specifically as a result of the lessons. And a key learning point following the lessons was not to keep problems to yourself, share them with others who can help you. While young people described enjoying the lessons, they had also sometimes experienced more negative feelings, such as feeling bored when lessons weren't interactive enough, or finding some topics upsetting or anxiety provoking. Next slide, please. But in terms of what facilitated impact from young people's perspectives, so young people found the lessons more enjoyable and engaging when they included interactive, creative, or practical exercises. And they valued the autonomy that they had in the lessons in selecting the subject of discussions, and they liked that these lessons were different to normal lessons that they had at school. They viewed the lessons as safe, non-judgmental spaces and felt able to give their opinions and share their experiences in the lessons without being criticised, judged, or made fun of. Next slide, please. But in terms of the barriers to impact highlighted by young people, so young people also spoke about limitations from their perspectives in the lesson content and suggested improvements. For example, they requested more space for them to share personal feelings and experiences in the lessons and to hear from people with lived experiences and mental health difficulties. And similarly, actually, to young people receiving mindfulness-based exercises and relaxation techniques, young people receiving the guide, YAM, and SSW also noted that misbehaviour during the lessons by other pupils could be distracting and disruptive. Next slide, please. What do school staff think? So we'll look at school staff perspectives now across all 5 interventions. Thank you. Oh, read my mind. So we conducted interviews with 60 staff members across all 20 schools in our case study school sample. And the staff represented a range of job roles, including senior leaders, teachers, and non-teaching staff. Representation of staff members was fairly evenly split across all 5 interventions. Next slide, please. So in terms of what facilitated implementation from school staff members' perspectives, so staff at schools implementing mindfulness or relaxation had found that giving students time to calm down and reflect had had a positive impact on their behaviour and learning, so echoing the young people's perspectives, as you can see there. Staff at schools implementing the guide, SSW or YAM, felt more aware of the issues affecting students as a result of the discussions that they'd had with students in the lessons, and they felt that students were more able to ask for support for themselves or for others. So again, that latter point echoing the young people's views too. Staff voiced their perceptions of the accessibility and the appropriateness of the intervention resources for students and noted that students with different mental health needs, learning needs, and demographic characteristics had engaged with the interventions. Staff across the interventions also referenced how the lessons fit with their school's ethos and culture around supporting student mental health and wellbeing, which was important in terms of supporting implementation within their context. And they spoke about how the intervention complemented or boosted schools' existing support offers. Staff had found it easier to identify a slot for delivering the interventions, particularly SSW and the guide and YAM, when they already had a regular PSHE or equivalent session timetabled in. And ease of delivery across all 5 interventions was seen as something that facilitated implementation. In turn, ease of delivery was facilitated by intervention brevity, particularly mindfulness and relaxation, training that staff received to deliver the interventions, and having ready-made lesson plans or manuals, or in the case of YAM, instructors and helpers who delivered for staff in school. Next slide, please. Staff at schools delivering mindfulness and relaxation felt that ensuring that sessions happened consistently and regularly was important as a facilitator for implementation. And staff across the interventions, not YAM, but across the other 4 interventions, reported making adaptations to the intervention format and content according to students' needs and preferences, and to ensure that the interventions fit with the school day. Adaptations that staff members described making for mindfulness and relaxation, for example, included adding new activities and resources to add variety, such as doing mindful walking, and to aid delivery, such as using music or visual aids for imagination exercises. For SSW and the guide, adaptations included having a wider variety of activities and lessons, making lessons more interactive, and that included things like breaking the class up into small group discussions and things like that. Next slide, please. Not all staff had noticed benefits of the interventions for their students, and they noted that there was varying engagement among students and staff members. For some staff, the intervention was seen as a priority, whereas staff also spoke about colleagues for whom the intervention delivery was not. And that meant that sometimes the delivery of the intervention could be inconsistent between staff members in the same school. Staff also described ways in which the intervention content could become boring or less engaging for students, again, echoing young people's perspectives. And that was primarily when it was repetitive, not interactive enough, or less relevant to students' own contexts and experiences. Staff also commented that sometimes boys and younger students had struggled more to engage with the interventions and felt that some students who struggled more academically or who were known to have attention, focus, or comprehension difficulties could find engaging with the interventions more challenging, such as finding it hard to concentrate or having more difficulties understanding particular terms or concepts. And staff also noted that it was not always easy to fit the interventions into the jam-packed school day or timetable. Next slide, please. And again, thank you. So in terms of limitations to bear in mind when considering our qualitative findings, so our sample of case study schools was self-selected to be involved, so they may have been more likely in general to be positively predisposed to implementing the interventions in the first place. Also important to note that the qualitative findings for mindfulness and relaxation are based predominantly on primary schools, and the findings for SSW, the guide, predominantly based on secondary schools. And the rationale for that was predominantly because the interventions, so YAM and the guide, were only delivered in secondary schools, so there were always going to be an overrepresentation of secondary schools in that sample. So as a consequence, we ended up speaking to more primary schools for the other sample. But it's just important to consider when thinking about these findings. Next slide, please. So with these limitations in mind, our findings suggest that at their core, new interventions need to be simple, easy, and practical to implement in a school setting. And it's clear from young people's and the school staff members' perspectives that having that space in the school timetable to learn about mental health support and self-help techniques was valued. But to maintain engagement and interest, interventions need to consist of varied and interactive activities for young people, with content that young people and staff perceive as relevant to their lives and to their contexts. I think that's all of them now.
Brilliant. Thanks, Emily. I'm aware, well done everyone for staying with us. There's a lot of content, as you can see, and lots to think about. I thought before we move on to the Q&A, I'm just going to very briefly pull a few key points together across all of this learning. And yeah, we can talk a bit more about what that might all mean as well in a minute. So I suppose thinking about the interventions themselves, what we seem to be saying is that the two tried and tested outside the UK, we're not able to sort of recommend really because of those sort of unintended consequences, potentially those negative outcomes we find in the longer term, and because some of them don't seem to show an overall impact in the first instance anyway. But what we do have is definite signs of promise for strategies of safety and wellbeing. So absolutely in primary schools and in secondary schools if it's delivered in full. And some signs of promise with relaxation and mindfulness, but oddly what we get, and I can see lots of questions about this in the chat, which I was resisting the urge to answer because I think we can discuss them in a minute, but we get for relaxation techniques that if they're delivered, consistently and frequently over time, they do seem to be beneficial for primary school children, but not in secondary school. In fact, if anything, it's worse the more we deliver. And the opposite's true for mindfulness-based exercises, where it's unhelpful the more it's delivered in primary schools, and then it's actually potentially beneficial if delivered consistently and frequently in secondary schools. So I think there's a few cross-cutting things to say probably about these findings. So one is any of the effects we see are pretty small. So these kind of universal interventions really are just one piece of the puzzle in terms of what we're doing to support children and young people's mental health, not just in schools, but there is lots more we can be doing in schools, that a whole school approach, but also, in communities and families as well. If we're going to shift the kind of rising trends that we've seen over recent decades, it really does need to be a whole system approach. We've seen that it really matters what you do. And so it's really crucial that we're not just with schools taking this approach, that we've ticked that box, that mental health box, that's done. It has to be the evidence-based thing, because we can see that not only do they sometimes fail to have an effect, but sometimes they can have unintended consequences. So it's really important to pay attention not just to the evidence base, but is it the evidence-based thing for that setting, for that age group, and so on. We've definitely seen that implementation matters, and the implementation kind of serves as an amplifier. So it's not just the more the better, but as we can see with things like mindfulness in primary schools, the higher the dosage, the more potentially difficult it is for the young people, if that's something they're going to find problematic. And also we've seen differences for different groups. They're not, there's not the most sort of coherently consistent picture about who those subgroups are across these interventions. But what it definitely tells us is we should be checking in with different groups of young people to see whether these things are having the intended impact, so that we can be sort of checking that we're doing the right things. Every context is different as well, so it's always important to be checking that these are sort of doing what we hope they're doing. So those are just some take-home thoughts from me. But I'm going to hand over to Martha now to kick off the discussion session. I'm going to ask everyone on our panel to also pop their cameras back on, please.
Okay, right. So I feel like our speakers have done a lot of speaking, which is totally fine. That's in the name. So I think there's a lot to reflect on. There's questions coming into the chat. I've got some of my own questions. I think first off, though, I'd like to turn to our champions, which is Gigi and Kate, and sort of get your thoughts on all of the staggering amount of information you just heard. So who would like to go first? I think I'm going to pick on Kate, because you've also got your teacher hat on. So I'm really curious to hear what your perspective is on all of this.
Well, unsurprisingly, one of the things that occurred to me was actually to say well done to the teachers, because what you've described is no mean feat. It's quite a lot for a teacher probably to wrap their head around. It's, as you said, fitted into a really busy and packed curriculum, and obviously they've had to give headspace and all the rest of it to what they've been doing. But also it sounds like they've been adaptive in the way that they have delivered the things, and they've been, creative and kind of giving you feedback about, well, this works if we do this and if we do that. And obviously they've brought their kind of specialism along with them to kind of tell you about how to deliver it. So I just wanted to say well done to the teachers, because I'm a teacher and I understand how hard it is. But my main question was actually for Emma, because I just thought it was really fascinating that there was actually maybe kind of unexpected differences between primary and secondary, and the way that things landed with those two different groups. And I know it's a bit speculative, but I just wondered if you had any kind of hunches about why some things worked for primary but didn't for secondary, or vice versa.
Yeah, and I think this was something that we quite puzzled over quite a bit when we saw the findings. I think I saw in the chat on the Q&A, for mindfulness in primary schools, I think it's entirely plausible that they're just too young to necessarily derive the benefit. I mean, it's quite difficult. I mean, I find it difficult as an adult to sit and really, focus on my thoughts and whatever. So I can imagine that being quite difficult for primary schools. And I think that is one speculative reason. And I think on the flip of that, for relaxation, because we did see those negative effects for relaxation in secondary schools, I think there's a whole host of reasons again, and it's not something we could definitively answer because we haven't looked at it. But the speculative reasons are things like, I guess, if you're sort of teaching people, like young people, to be sort of introspective and sort of really aware of their own feelings and standings, then they're more aware of it, but not necessarily equipped with skills to sort of approach the fact that they're more aware of these things that they're feeling. And something else that we do dig into in the paper as well is the fact that these were sort of universal school-based interventions, so it's possible that some kids just didn't want to do it and therefore would kind of felt like they were made to do it or something like that. So that was another reason in the paper. But I think the main things that we sort of decided, or that I sort of think, is for mindfulness, I think it's probably just not age appropriate for younger children and for relaxation, I think like it's important to follow up and make sure the skills to sort of deal with those increased feelings. Does that answer your question at all?
Definitely, yeah. And some of it makes quite a lot of sense and seems quite logical as well.
And I guess they're just my opinions as well. So others on the call might have different opinions, but yeah.
Thank you.
Thanks very much, both of you. Gigi, what do you think?
Sorry, the microphone on my headset doesn't seem to work with Zoom. I thought the presentations were very interesting, and I have one particular question which pertains to secondary schools more, and that was whether in the research design there was any consideration for the time of year at which baseline and the endpoint occurred, because there's research to suggest that there's a positive association between academic pressure and mental health issues. And I'd wondered if potentially the reason why there were increased mental health difficulties could be because it's a high pressure time of year that you took the endpoint results. So I don't know if anyone wanted to give any information about that.
I think Jan wanted to, but I mean, Jess could take it too. So do you guys want to fight out who answers that one?
I can at least start. I think there are two questions in that. I think one is answerable by, we looked only at the differences at the time points. So in that case, it would mean that with the interventions, something specific would have needed to go on in those schools that the interventions were delivered. And therefore, that is by design not very plausible. So that is something that we try to rule out by design. But the second part of your question, yes, since we had the same design for all of the waves of data collection, we couldn't rule out that there might be systematic differences across the year. And given that the results are so small, that if we delivered and assessed this in a very, very relaxed time of the year or so, that the intervention might cut through more potentially. So that's something we couldn't look at. I'm not sure, Jess, whether you want to.
Yeah, maybe just to kind of I have to put it in terms that I can maybe understand, Jan, but I think I completely agree. So I think the thing with quite often we are battling that exactly, Gigi, which is often if we're doing longitudinal research, for example, we have to always be careful to put the time point exactly the same each year, so that any changes are probably more, over time than they are to do with, is it an exam period or that kind of thing. But with a trial where we're comparing the control group and the intervention group, it's less of a concern, because it'd have to be, if the exam period is the same for all those schools, that it's more about the difference between the two. So I guess there is a world in which there might be an interaction between the intervention and the exam period, which might mean some of that difference is accounted for by that, which would be an interesting thing to think about. But that's something we probably couldn't control for, but we certainly can rule out it's happening. That exam pressure would be happening in both groups at the same time, essentially.
Thanks both. Okay, I'm going to turn to some of the questions in the Q&A. Don't worry, I have some of my own too. There's quite a few different questions, but I think I'd like to hear a bit more about young people and how they impacted the research. And I think I'm going to pick on Emily Stapley here a bit to hear a bit more about the kind of qual experience around this.
Sure. So young people's involvement, qualitative strand-wise, was mainly in the development of our interview topic guides, in terms of thinking about how we tap into areas of impact and barriers and facilitators and mechanisms from young people's perspectives, because those words alone are ones that aren't particularly intelligible in an interview context. So what we wanted to do was work with young people to formulate questions that meant that we were most likely to reach our sort of research goals. and not lead young people down a particular path either in terms of what outcomes we might expect to see, for example, from the interventions. So I think the main involvement really that young people had was in terms of the design work for the qualitative strand. In terms of the quantitative strand, I actually don't know. So I would have to pass to Jess for that, if that's all right, being in my qualitative strand bubble.
Yeah, so there was consultation with young people, I think, about the measures at the beginning. Not I think, there were about the measures at the beginning. And another thing where young people were involved was in that period that I mentioned, there was more the sort of development and feasibility testing. So when we had that period where we were particularly when we were trying to think about how the interventions would work in schools, and especially for those that were more the ones that hadn't been kind of formalized before, there was a period where we worked with a smaller number of schools. And so the school staff and the young people within those schools had some input into telling us what wasn't quite working well, what needed to be adapted, that kind of thing. I would say it's interesting to see how far we've come in our projects because, as I say, this one started in 2017. And I think it's a bit of its time in that if we did this again now, we would definitely have much more young people in the decision making on an ongoing basis, like we do with pretty much all of our projects now. So it's sort of reassuring to know we've made some distance travel, but it's a shame we missed some opportunities to have more involvement.
Thank you. That was really helpful. There's a few different questions, so I'm going to kind of summarize them, but they're very much around different kinds of representations and how that did come across or didn't come across in the data. So I think it'd be really helpful just to hear a bit more about pupil data and the kind of categories that you were able to pick up on in terms of students or weren't. And I'm probably going to turn to Jess on this one, maybe Emma, I don't know.
Can I clarify a bit? Do you mean who was part of, how we described the group that we were working with, or do you mean how much we were able to dig into sort of different characteristics?
I can't just say yes, but let's go with the first one and then the second one.
Okay, so in terms of how we well, I can see a couple of questions in the Q&A. So there were some about sort of who and how we kind of controlled for a range of things. So just to say, we were collecting information to describe the young people involved in studies and the schools. So things like the ones I mentioned at the beginning, like whether they were eligible for free school meals, which for those who may not know, it's that's basically a kind of a proxy for low income, I guess, or experience of poverty, and then we would know their special education if they had a sort of special educational needs sort of status, for example. We also could look at things like at their baseline measures. We could see if they were already had sort of quite high levels of emotional difficulties to start with, for example, and we collected some information about how they were sort of viewing the school environment, that sort of thing. And some of the things that we might think of more at a school level, we try to control for in the way that we allocated the schools. So when you do a randomized control trial, you also want to sort of make sure you don't create systematic biases in who gets allocated to those different groups, because you suddenly realize, oh, look, we've put all the schools with high numbers of children who are eligible for free school meals all in one thing, and now we don't know if it was down to that or whether it was down to the intervention. So we try to make sure that that's sort of balanced across the sample and the way the arms of the trial work, if you like. So there are a number of characteristics that we kind of looked at that way. And then, there were lots of things we would love to have known. So I saw someone had asked a question about whether the young people's culture, I think that might be what the question was, whether young people's culture had any kind of impact. I don't think we really measured culture. We've got a very limited set of characteristics that we can look at. So it would have been great to look at that, their cultural background. But we had things like ethnicity and SEN, as I say, and, gender and, sort of a limited level of descriptors. But we try to use those things to try and ask the questions about whether the intervention sort of landed in different ways for those different young people. And that was exactly what Jan was going through in those modification analyses. I don't know, Jan, if you wanted to say anything further about that.
No, I don't think there's much to add to that.
Okay, great answer to a slightly woolly question that I made up from 3 people's questions. Great. So I think I want to pose a question to kind of everybody, champions, speakers, because we've seen a lot of different reactions in the chat and to the research. And I suppose we're talking about implementing these interventions in schools from, as Jess was just saying, from when the project started to now, the world has changed drastically. Our approach to research has changed. So thinking about this gigantic 7-year project, what have we really learned about implementing interventions like this in schools? And not necessarily if you were to do it all over again, what would you do? But what's the kind of future of this route? And just because you said no, nothing to add to the last question, we're picking on Jan first, and then hopefully we'll get to everyone after that.
Okay. I think what I learned, not only from this trial, but about 7 or so others that I led over the similar period, is really just, on the one hand, how to design interventions that cut through in these settings, schools in particular. So it's also for educational interventions, but you have a background of well-trained people who are delivering their stuff. They have experience, training, CPD, all these kinds of things, and they're doing a good job, probably. And then you want to input something on top of that that makes a appreciable and measurable, in my case, for quantitative analysis, difference. And that is, I think, very difficult. And I think it's one of the things that this program shows is really important, that we test that and evaluate that to see, well, which of these things work with the qualitative and the case and all these types of other things that we can put towards that. And the other thing is from that, probably mechanisms, focusing on mechanisms of things that might work instead of packaged programs. So rather think of, okay, what is the thing that we want to change? In a bit of a smaller scale than we have an 8-week program that does this and that. No, what is it, for example, relaxation? Is it teaching about certain strategies or so that can be packaged in smaller units and in different combinations as schools might need that? And evaluating such mechanisms is probably a very important way forward as well.
Good starting answer. Who wants to go next? I feel like I'm going to pick on Emily Staples.
It's honestly sense that, Martha. I feel it coming my way. I think that what I've learned is that schools are all different and they are all busy and they are all complex organizations. So if you are trying to impose a standardized intervention across organizations who are all different and all busy and all complex, then the interventions that you are asking schools to implement need to be as easy as possible to implement. And it is up to us as the research team or the developers to make sure that that's possible and to facilitate that. But that also, if we expect schools to have space in their timetable for a lesson, a new lesson, then they need to be helped to enable that space if they don't already have a designated PSHE slot, because otherwise how you fit that into something that's so jam-packed is really tricky. And then I think finally, fit of the interventions with what schools are already doing in terms of support and what they would like to offer is also really important, because schools need to know that what they're going to be delivering that's new doesn't duplicate anything they're already doing, doesn't add unnecessary burden, and actually improves what they're already going to be offering. So I think that's my learning, I think.
Pretty good learning there. Okay, I'm going to turn to Emma next.
I mean, I think in terms of what I've learned, I was going to go down a similar route to Emily, that schools are incredibly busy. And so, I mean, I was more involved in the sort of survey data collection rather than the delivery of the interventions. But even sort of in terms of that, trying to get schools to complete the surveys, which are obviously a really important part of the research, just sort of making sure that we make that as easy for them as possible, making sure that it'll all work when they try and do it, because we had a few instances where we'd get a school on the phone, they'd got a classroom of pupils ready to sit and do the survey and it wasn't working. And then obviously they've already taken the time to sort of take that time out of the timetable to do our survey for it to then not work. So I think from that perspective, just making it as easy as possible for the survey to be done. And in terms of sort of the future, I think it's similar to what Jan said in terms of mechanisms, but I think these things aren't a one size fits all. I think different things are going to work for different pupils. And I mean, in an ideal world, you'd have a different thing for each person, but that would just never sort of work in reality. But something tailored, whether that be through speaking through to different groups of pupils, different demographics about what is sort of important to them, what would work for them, and sort of bringing that into the intervention design, I think would be really helpful. But yeah, I don't really have much else to add.
That's great. Thanks, Emma. I am going to get to you, Jess, but I think we should go back to our champions briefly. And I suppose your exposure to this research and this project is slightly different to everybody else's here. But I'd be really curious to hear your thoughts in relation to my question about, implementing these kind of interventions and your thoughts as a teacher and as a much younger person than everybody here.
I don't know that I've got that much more to add. I definitely agreed wholeheartedly with what Emily was saying about not replicating things elsewhere. And I suppose as well, maybe some consideration to which year group it would be the most beneficial for, because we haven't really talked about year groups, but in secondary that will make quite a big difference, as I'm sure it will in primary. When's the most beneficial time to get to them and to have this intervention and that kind of thing. But yeah, I mainly agreed with what Emily was saying.
And then for me, I think it's very important to support the schools to make it as easy as possible. So in supporting them to create that extra time to do the interventions, because if the teachers are under a lot of pressure, which during my period at school they were because of austerity, like I am unsure how, when I was at school, these interventions would have been implemented if there was an extra resource to allow them to do that, whether that's funding or allowing extra time in the day, however that's done. But I think supporting the schools to enable them to give it its best shot is really important, as well as thinking about the year groups, particularly in secondary school, because there's a lot of change, particularly around puberty. So whether, because a child in year 7 is going to be very different to a child in year 9 or 11 if you implement this. So yeah, those are my thoughts.
Thanks very much. And Jess is going to take it home for us. So thanks very much to everyone on our panel.
I feel like I've either been given the easy job or the hard job, because everyone said everything and I completely agree with it all. So in that way it's easy, but coming up with something new is difficult. But I'm not going to do it just to be perverse, because I think these are the really crucial points. I do think the way forward is much more with schools. I would love to see more co-production with schools. And I think it's really telling that some of the most successful interventions in this programme were the ones that teachers helped us work on and make sure they worked in schools, and also the ones that they commented felt most like the kind of thing they would do, and it felt like it was in their sort of territory, and they were comfortable delivering it. So I think there's a lot to be said about that. But I absolutely agree with Jan in terms of a bit of deconstruction actually of some of these quite complex and weighty interventions, to say, if we strip this down, what really is the important thing? The Wellcome Trust for a while have been talking about active ingredients, and I think if we could have a list of active ingredients rather than these very kind of comprehensive and quite hard to implement programs, that would be great. Really love to do that. I think that's probably as much as we can get from our discussion. I've just realised we've hit 7 o'clock, so we should definitely finish up here. But thanks so much to everyone. Thanks to all of you for joining, for sacrificing some of your sunshine to join us for this conversation. It's been Brilliant. Thank you to everybody who spoke. And they represent a much bigger team who I can't even say how, it's probably totals hundreds by the time we've counted everybody who got this programme off the ground running and got the results churning and out there. So big thank you. That was a collaboration between Anna Freud, UCL, University of Manchester, University of Dundee and LSE. So yeah, quite mind-boggling, and all our schools division colleagues as well. Massive thank you to Gigi and to Kate as well for bringing your perspectives, really helpful and insightful, and a good reminder of the kind of things we should be bearing in mind when we're doing this work. I also want to say thank you to the events organisers for smoothly taking us through this whole process. Just to remind you, please do complete that feedback form and look out for the slides and the YouTube video of this event. And hopefully we'll see you in a few months' time for the next So What seminar. Thanks so much, everybody. Great to see you all. Have a good evening.